I'm a preventive cardiologist, so to me, it's so exciting right now for all the new therapies in cardiovascular disease prevention. And I think that's what's making our field not, so exciting, but also growing so rapidly. We now have tools that we didn't have before. More than just statins, we have new novel medications that can help us lower cholesterol. We also have medications to help our patients with weight loss, which has really been lacking. And these are medications that we know pretty well. We've been using them for diabetes, and yet we found that there's another role for them, that they can assist in weight loss. And I think that's probably one of the most frustrating things in the cardiology field. We understand that people who are obese have a disease. It is a disease. We haven't had a treatment. And we know what we've been saying to patients really doesn't work. Watch what you eat, or, move more, eat less. Believe me, every one of my patients who is obese has tried all of those things. What we haven't had is a way to help the underlying causes of why people overeat, why they can't control what they eat. And these novel medications give us that opportunity. And I think these are real game changers, because we know that, a big portion of our population is either overweight or obese or morbidly obese. Now we can offer them something and really change their risk for the future. And I think over time, as we learn these medications and use them, these are really going to help us. I think also, I do a lot of work on women and cardiovascular disease, and I think the exciting things that are happening in this field is, first of all, we're studying women, and second of all, we're learning a lot about the sex differences between men and women, and that's going to help us really have precision therapy, knowing what works in a woman versus what works in a man. We need that information, and so I think that this is a time that we are really changing how we care for both men and women. When I was in medical school, I remember a very famous cardiologist coming to Canada and speaking at my medical school. She came from the US. Her name is Dr. Nanette Wanger, and she's really the mother of cardiovascular disease in women. And when I met her all those years ago, I remember her pointing out, and I didn't know this at the time, she said, we really haven't studied women. And I think I was slightly shocked to hear that. And being a woman, that just, why would I be excluded, or why would people like me be excluded? And hearing about all the differences from her in that moment, I remember saying, I know what I'm going to do. I wanted to be a cardiologist already, but I'm going to study women. I'm going to be part of curing this problem. I'm going to study them. And I'm in a very fortunate position to not just be doing what I said back many years ago, but to almost exclusively care for women. I think for any of the young people thinking about a career in cardiology, it is something that's so rapid-pacedly and changing every moment. Not just in terms of new medications, new therapeutics. We put in devices, we do procedures. We have the best of the surgical world and the best of the diagnostic world in cardiology. And I think that it is such an exciting field. I think we also have a very strong community of women in cardiology, and also men who raise us, the he for she's, as we call them. And I hope that people recognize that this field needs more women and needs more of us here at the table, doing research, caring for our patients, teaching the next generation. And I hope that other women will find what I found, gives me the spark every day to wake up and go to work.